Hello friends, let's learn about the intravenous fluid, IV fluids. Types of intravenous fluid are: the first one is the crystalloid and the second one is the colloid. The crystalloid contain water and the electrolyte, and the colloid mainly contain the protein and the high molecule. The example are the hemacil or the albumin. Now we will discuss about the crystalloid in this lecture. The crystalloid mainly are the three types. The first one is the hypertonic, the second one is the hypotonic, and the third one is the isotonic. The hypertonic means osmolarity of the fluid is more than the body plasma. Hypotonic means osmolarity of the fluid is less than the body plasma, and the isotonic means osmolarity of the fluid is equivalent to the body plasma. Now we will discuss about the normal saline, 0.9% NS. It contains the 9 gram of sodium chloride in 1 liter of water. It is isotonic or slightly hypertonic. The osmolarity of the fluid is 308. The osmolarity of the body fluid or the plasma is 270 to 290. So it is a isotonic or slightly hypertonic. It contains 150 milliequivalent per liter of sodium and 150 milliequivalent per liter of chloride. The indications are: we can give the normal saline during the vomiting, diarrhea, diabetic ketoacidosis, hypovolemic shock. And we can also use normal saline as a dilution of drug which are in the powder form. What are the contraindication of the normal saline? When the patient is in the fluid overload like congestive cardiac failure, nephrotic syndrome or chronic kidney disease, we should avoid the fluid. What are the side effects of normal saline? It can lead to the hyperchloremic metabolic acidosis because it contains the chloride. The second fluid is the 0.45% normal saline, or it is also known as a half NS, because it contains 4.5 gram of sodium chloride in 1 liter of water. It is hypotonic. It contains 77 milliequivalent per liter of sodium and 77 milliequivalent per liter of chloride. Indication is the hypernatremia, when the sodium level is more than 155 milliequivalent per liter, because it contains the low amount of sodium. So we can ingest a more water and the less sodium, so the sodium level comes down. The next one is the 3% of normal saline, 3% NS. It is hypertonic because osmolarity of 3% NS is 3 times than the body plasma. Every 100 ml of 3% NS contains the 3 gram of sodium chloride. The indication is the severe hyponatremia, when the serum sodium level is less than 115 milliequivalent per liter. It should not given during the hyponatremia if the signs of hyponatremia is absent, and the sodium level should not increase more than 7 milliequivalent in the last 24 hours during the sodium correction. It can also given during the raised intracranial pressure in case of hemorrhagic CV stroke like intraparenchymal hemorrhage with intraventricular hemorrhage or the brain tumor, because it shifts intracellular fluid to the intravascular compartment and it reduces the intracranial pressure. The contraindications are in the fluid overload. It cannot given during the fluid overload like CCF, CKD or nephrotic syndrome. The next fluid is DNS. It contains a 50 gram of dextrose anhydrous in the 1 liter of NS. As we all know, the NS means 9 gram of NaCl in 1 liter of water. It is isotonic as a normal saline because dextrose doesn't contain any osmolarity, so adding on dextrose in the NS does not increase the tonicity of the fluid. So it is a isotonic. The dextrose is a type of glucose that provide the energy 4 kilocalorie per gram. So indication of DNS is when we require fluid replacement along with the calorie replacement, then we can give the DNS. 5D or 5% dextrose water. It contains the 50 gram of dextrose anhydrous in 1 liter of water. The difference between the DNS and 5D is, in the 5D there is a 50 gram of dextrose in 1 liter of water, and in DNS there is a 50 gram of dextrose in 1 liter of NS. This fluid is hypotonic because dextrose doesn't contain any osmolarity or tonicity. The next fluid is the ringer lactate. It is the most physiological fluid as the body plasma because it contains the electrolyte similar to the body plasma. The indication of ringer lactate is in the diarrhea, post-operative patient when the patient is nil by mouth. It is the treatment of choice or fluid of choice during the burns. It can also given during the peritoneal irrigation. It can also given during the treatment of diabetic ketoacidosis. The contraindications of the RL is volume overload or fluid overload, hypoxia, liver disease and the vomiting. Why in the liver disease? Because the lactate in the ring RL contains the ringer lactate. The lactate is metabolized by the liver. If the liver is damaged, then it cannot metabolize the lactate and the lactate level is increased in the body. So we should avoid RL during the liver disease. And the lactate is metabolized in the liver and it converted into the bicarbonate. So during the alkalotic condition, we should avoid the RL. The vomiting is the condition during which the patient mostly in the alkalotic condition, so we should avoid the ringer lactate during the vomiting. During the diarrhea, patient mostly in the acidotic condition, so RL is the treatment of choice during the diarrhea. The next one is the 25% dextrose water. It contains the 25 gram of dextrose in 100 ml of water. It is hypotonic. The indication is the hypoglycemia. It is a magical molecule when the patient comes in the drowsy or altered sensorium in the emergency department. We can give D25 and the patient improved within a few minutes. It can also given during the total parenteral nutrition as an energy source. Along with the intralipid or the amino acid during the total parenteral nutrition, we should give 25% dextrose water as a energy source. We can also give D25 as a correction of the hyperkalemia. In the D25 we can add 10 unit of plain insulin and it shifts the potassium from the intravascular space to the intracellular space and the potassium level is reduced. The another fluid is 50D or 10% dextrose water. 50% dextrose water contain the 50 gram of dextrose in 100 ml of water and the 10D contain the 10 gram of dextrose in 100 ml of water. I hope you would enjoy the session. Thank you.